It's amazing the challenges for the mom when it comes to breastfeeding. Everybody says, 6 months, 6 months. But for the mom who is working, you've heard it from them, it's not as easy as it sounds. So I've got Dr. Wenga Awoshika in the house again. Welcome to the show.
You're welcome.
And we want to talk about lifestyle, the modern woman's lifestyle, and the issue of breastfeeding, a guide for her, because a lot of modern women work. It's not like our parents' days where mom stayed at home and dad worked. Dad and mom work now, and the common practice is 3 months after birth, maternity leave. So what happens when you go back to work? And all you doctors tell us 6 months at least. What do we do? First of all, before we even go to what do we do, this 6 months minimum, doc, is it like minimum, or can we manage 4 months?
Well, in 1991, the World Health Organization and UNICEF had a congress, and the baby-friendly hospital initiative was adopted, where all hospitals promote breastfeeding for 6 months, up to 6 months, without any substitute in between. That is exclusive breastfeeding. And that is what almost all hospitals nowadays preach. And there are advantages in this exclusive breastfeeding. Breast milk, human breast milk is superior to the formula feeds in many ways, because this actually contains a lot of things. For example, in the first few days after birth, the first few days, what comes out is called the colostrum. It is a very rich in anti-infective properties, which the baby might need to boost the anti-infective war the baby will be fighting at that time, to also supplement the baby's immune system, which is at that time undeveloped. The breast milk is cheap. It doesn't have to be refrigerated. It doesn't have to be prepared. It's a safe, cheap way of getting our babies nourished. The breast milk contains all the baby needs, all the water the baby needs. 70% of the baby's body is made up of water. 70% of breast milk is water. It contains the carbohydrates enough that the baby needs, enough proteins that the baby needs, enough fats, minerals and vitamins that the baby needs. So I will advise all mothers to make sure that babies are breastfed for as much as possible. In a study conducted in England, about 67% of mothers breastfed initially, and after 4 months, only 40% were breastfeeding. That's a sharp drop compared to what we find in a study conducted in rural Nigerian women. In rural Nigerian women, 92% of them were still breastfeeding up till 1 year.
Wow.
But remember, I said rural Nigerian women. The problem we have in the urban Nigerian women is they're already westernized. So they have Western problems. So they behave like the ones in England. So they have to go to work, and it's quite challenging.
Yes,
Yes.
On behalf of the urban Nigerian, look, after 3 months, we have to go back to work. And not every workplace has a creche to put your child in, or even if you say a creche around the area, if you work on the island and places like that, the creches around the area is your whole salary at the end of the month. So what are the alternatives, like expressing and all that? What are alternatives?
Yes, I think a lot of women should be encouraged to express breast milk. At least breast milk will still last for 12 to 24 hours if it's well refrigerated at the correct temperature. And you can just be slightly warmed and given to the baby. They should express in the morning, and babies, maybe their mother-in-laws or whoever is taking care of the baby, should be able to feed the baby with the breast milk. And also, I think there should be a law by the government that workplaces should have in-house creches.
That would be so fantastic.
That would be fantastic. That would go a long way. I think it should be built into our laws that all those big workplaces, hospitals, banks, and multinational companies should have standard creches where women will just drop their babies and can always breastfeed at intervals while they're working. Or in the alternative, they should maybe make women go on maternity of 6 months.
Oh, that I think I agree with.
I'm aware that the labor movement is trying to push at least 4 or 5 months, and I think they're really pushing hard to increase the maternity period for women in this country.
Okay, so now we know that it has a lot of advantages. I wanted to ask also that some women, when they're breastfeeding, I don't know.
To children that were started on breast milk early in life. So children that are breastfed are not likely to have asthma later in life.
Okay. All right, Doc has convinced us. He has he's schooled us today, so no excuses. Thank you again so much for being part of the show today.
The pleasure is mine.
All right, we'll take a short break. When we come back, it's still Mothercare, and of course, we still have our doctor on demand. Your questions are going to be answered. Stay with us.